I'd been at a conference where a lot of physicians were very concerned. They said, we don't know how long patients have, and we don't want to give their prognostic information, and why bother doing that? We don't get reimbursed for it, and there's nothing to be gained by it. So we studied that, and we found that having end-of-life discussions did predict patients planning better and getting better quality of care at the end of life. The concern had then been that when Obamacare started was on the table, people started talking about death panels, and that the motivation of that was to save money and ration care. So what we did was we plotted the quality of life of patients and their family members against the cost of care in the last week of life, which is a crude assessment, but a quarter of the Medicare budget goes to care received in the last year of life. For that 5% of Medicare patients who die, a quarter of the budget is going to them, and 40% of that's for the last month. So catching the last week is suboptimal, but it's sort of tip of the iceberg for the costs incurred. So we wanted to know, if you spend more, if Medicare spends more, what's the are you buying better quality of care and better quality of life? And the answer was the opposite of that. So what we found was that the more spent, controlling for a lot of confounding factors like performance status and things that are very geeky. But we found in a very rigorous analysis that the more spent by Medicare per patient, by far the worse quality of life that the patient had, and more suffering in the last week of life. So when people are concerned about rationing care, we think that there needs to be a reality check on what that care is buying in terms of the patient's quality of life. And also we find that the family member who observes a patient suffering like that has scars, emotional and psychological scars of witnessing their loved one suffering so much. So the point of our research is to pinpoint effective communication, how understanding your illness and treatment options effectively improves the care that a patient gets at the end of life, and their family member's survivorship.